Yat e siya na esik es kia ani neshle do bilagana Viking people basis chin des chini des che do bilagana des nole she amber kinas bakradi inishet tall hot soy then not sha, and I've been honored to represent as a public servant to the communities of Sheep Springs, Two Great Hills, Todlina, Sanosti, Red Valley, Cove, Kadiahi, and Biklabato. We're in the Northern Agency, so on the council, I sit on the Budget and Finance Committee. I represent Northern Agency in those discussions and vote for the benefit of Northern Agency. Some of my passion work is working with our elders and veterans communities who have little to no agency, which means they, at some point in their life, they've been told or they've experienced where their voice does not matter. And so it's learning and advocating for those relatives so that their needs are met by their government. And we do that work as the chair of the Sexual Assault Prevention Subcommittee, also with our missing and murdered dinner relatives. And I'm on a community-based housing justice group, and we have other work groups that we work on. So what I thought today would be more of a way for us to share the collective knowledge in some of this work. Some of it can be very emotional, and some of the tools we've used with ceremony, getting trauma-informed counseling, utilizing trauma-informed practices, and realizing that people are doing the best that they can. I wanted to incorporate beyond just the chapter monthly meetings and reports, but start talking deeper about the discussions that you may have read or seen a post on Facebook. The way that that best provides positive solution for Navajo Nation is to have ongoing conversations and dialogue about what's happening in our communities, what type of information we need, where do we go from here, how do we collectively work together. So I just wanted to start by saying today we had a great discussion at IHS, Indian Health Service. They had their fiscal year 2025. So 2025 is 3 years from now. And so that's why leadership is so critical, because you have to build up these priorities and how to move forward when it comes to healthcare at the very least 3 years in advance. And the challenge there, of course, is we don't know what our funding will look like. We don't know what our federal congressional leadership in Washington, D.C. will appropriate. This year, we've received additional dollars, especially in the water infrastructure area of Office of Environmental Health, and talking to their team. But it's important for Navajo Nation leadership to understand that health is our wealth and that our people are our greatest resource. And if we collectively continuing to collaborate, we can develop that pathway to address some of our chronic illnesses that we see on the nation among our families, like obesity, type 2 diabetes, cancers, also looking at different chronic liver, like psoriasis, and looking at how we see lung and heart disease here on the nation, and what contributes to those chronic illnesses, what type of access do we need. So we had a really rich conversation this morning about the forecast of COVID and monkeypox and other co-occurring illnesses, what we need to do when it comes to construction of healthcare facilities, and looking at what is the future of Gallup Indian Medical Center. So you may think, well, why would a delegate in Northern Agency representing 7 chapters be on meetings where we're talking about construction of medical facilities? And the reason why is it's so important to the Navajo Nation in whole. Our relatives are not only living here in the district, but if we could streamline the process in getting healthcare facilities built, we also want complementary healthcare facilities like increasing our drug treatment, behavioral health. Today I discussed sexual assault, nursing examinations and rooms, and to help with victims and the survivors of violence, and also looking at how we could create long-term continuum of care. So days like today, although it was a work session, it sets the ground for what Navajo Nation will submit to the federal government in a few weeks on what are our priorities as a nation, as a people. So those are conversations I think we could dive deeper into if you want to learn more in terms of what was discussed. And so my commitment is trying to create a public sharing hub of Navajo Nation documents. So if you are a community researcher, a community leader, or you just want to know what is being advocated on behalf of you and our Navajo Nation, you could have access to those documents and to those presentations. And they gave great recommendations. They identified and highlighted great collaboration. And I think that's really, if we could look at more of our issues here on Navajo Nation through a public health lens, we'd have that multidiscipline approach. And I think, connecting the homes, connecting the schools with the hospitals, with transportation, with behavioral health, with public safety. These are all critical connections for a family, for a community to have a safe environment. And so I think it's important, and I look forward for tomorrow's discussion in terms of what else is going to be presented by Navajo Nation Department of Health and the Indian Health Service. So with that in mind, I really wanted to focus this conversation about last week. So we had elections, and I think it was a long day if you observe the eclipse, and then election day. And so in the morning of Wednesday, we were able to see the results, and I want to thank all of the voters who came out and casted your vote. And I think either way or however you voted, that's your decision and your choice. But also, what I wanted to do after giving prayers and offerings and looking and continuing to seek guidance, I met on Wednesday with our advocates in the Shiprock area who are trying to reopen the Shiprock shelter and have reported to the Oversight Committee, Health, Education, Human Services, what are some of the challenges, what are some of the opportunities, and how we could continue to advocate for relatives who need help, who are in a situation where they either need a protection order, they need emergency housing, and also looking at what are some of the limitations when it comes to our male relatives who are in a violent situation, and how can we have a safety plan and get them to a safe space with their children if needed, or how they can have access to some of our wraparound services. And if there's limitations at certain local shelters, how do we collaborate with others? So we're planning, because the holiday season is coming up, we're going to be planning a resource meeting in January. And that's where we'll bring together all the individuals who provide resources here in the Four Corners or Northern Agency. What we would like to see is to host other resources for other agencies, and that can build up this kind of movement that we're creating for Navajo Nation to have community-based advocates and to be able to provide services wherever services are needed among Navajo Nation. In addition to meeting with the advocates, we also sat down with our missing and murdered Dene relatives advocate who are working with the families and making sure that our recommendations and making sure we're hearing directly from the families and what are some of their recommendations. Like we've heard from, Trailing LMA, Seraphine Warren, in terms of like having search and rescue teams, having equipment, getting travel costs to go to and from search sites. And we're also looking at what it would take to get private investigators. We've had some cases in the past where a private investigator was hired, looking at the capacity of our local law enforcement, what's the capacity in terms of partnership with our border towns or county law enforcement, and of course our federal partners. So that is going to have additional discussion because of jurisdiction, because of access to records. But I think it's always important to create that safe space for survivors and their families to provide those recommendations, not only to Navajo Nation leadership, but how are we going to prioritize those resources. So what we're doing is we do fundraising at a local level and just try to help and support as much as we can. And actually this Friday, we're going to launch a fundraiser with partnership with Pendleton and Cellular One. And we were able to secure donations to purchase, or 30 blankets have been donated to our missing and murdered families. We know 30 blankets is not enough, unfortunately. We have over 80 active cases. And so we'll continue to do fundraising. But this Friday, we just wanted to create a healing space for families that have reached out and have asked for support and have really had the courage to advocate. And so we feel like this is just the initial step, learning kind of step. And we want to make sure more blankets will be available to all of the families. And so we'll be, I think tomorrow, I got to talk to some of our volunteers and seeing if they could develop that type of donation campaign, because that's all community volunteer based led. And we have some amazing folks on our team that do really great graphics, have a large network, and want to continue to support the families. And this could be a way. The last thing I wanted to talk about was from those discussions, we had a tribal consultation with the Office of Violence of Crime. We do have a tribal set aside, and the Navajo Nation Council has designated Utah Navajo Health Services to apply and administer on behalf of the Navajo Nation. They've partnered with Victim Services of Northern Arizona, so they've been able to provide advocates, community-based advocates throughout Navajo Nation. And so with their help, as this is our first year, we have the ability to also provide some support to our missing and murdered and their relatives' families. And so the questions on the tribal consultation are what support or what best practices are out there. So some of the tribes up north are doing amazing things like the Red Blanket Project, or out in St. Clair, they're really expanding what it means to have this continuum of care for families that have been isolated or silenced because their loved one is missing. So we'll continue to have those conversations, but I just wanted to do a recap. I wanted to see in terms of time, where to do the video, what time of the day. I'm a morning person, so it's getting later on the day, so I had to really figure out where this light is at and set up this stand. But I'm gonna post this on our channel, and my goal is to continue to have these conversations. That's my dog, my rescue dog, Coco. She's a drama queen. But also just making sure you get the documents, because there are people out there who ask me questions and I want to make sure you have that information. So have a good evening. That was the recap from Wednesday, a little bit about this morning. But I think in terms of understanding the role of the delegate, the representation, and the type of research and information that we need to make the best decisions possible on behalf of our Navajo people. So let me know your thoughts, and we'll continue just to have these conversations. My hope is we can invite others, or at least have more of a question and answer type of dialogue, so that I'm not discussing issues or not being clear in terms of what's happening, or sometimes like the background story, or giving you enough information so that you could follow the discussion in a meaningful way. So be careful out there, be kind, and take care of yourself. We'll see you. Hagwanet.